Hello and welcome to another episode of the Health Notebook. Today we have Dr. Parker in the studio, also known as the Hajj Doctor, and we will be discussing the common medical conditions associated with traveling. Dr. Parker, welcome to the studio.
Thank you, for once again inviting me. It's always a pleasure being here.
Okay. Dr. Parker, we've discussed a little bit about the Hajj preparation before. Just to recap, or just to give the viewers some pointers in terms of preparing from their health perspective before they actually go on Hajj. Can you maybe just highlight one or two of those important points?
Because our first group of pilgrims will be leaving in the first week of August. So getting fit is a bit late now, which is one of the issues that we always harp on about, simply because Hajj is a very physical journey. It tends to be considered just as an emotional, spiritual and intensely religious journey, but the reality is that people have to walk at least 5 times a day to the mosque and back in temperatures of close to 45, sometimes even 50 degrees. So getting fit for this type of physical exertion is quite important. What we also emphasize, especially this year and the next few years when the Hajj is going to be in the summer months in Saudi Arabia, is for people to ensure that they are not too exposed to the sun. In other words, they must travel only to the mosque and back and not walk around outside in the temperatures which, as I've mentioned before, can go up to 50 degrees. So they must minimize the exposure to it. They must wear loose-fitting clothes, minimal layers of clothes, because often in Saudi Arabia people wear multiple layers of clothes. They must also ensure that they are adequately protected against the sun. So even if they go in for short distances, they should be carrying umbrellas to shield them against the harsh sun as well as the intense heat.
Okay, and what about keeping some fluids available as well?
That was going to be my next point. You preempt me, but absolutely, hydration is absolutely important. Literally walking just 100 meters in this type of temperatures can really drench people with sweat. The advantage they have in Saudi Arabia, though, is that there's a substance called Zamzam, which is considered one of the most nourishing and one of the most medicinal medications or fluids on earth. It's freely and abundantly available in the mosque in Saudi Arabia and even in the hotels itself. So there should not be a problem in obtaining the fluids, but it's the issue of people actually consuming it and making sure that they are well hydrated all the time.
Okay, so let's assume you don't follow the necessary steps and you don't wear the appropriate clothing, you're continuously in the sun and you don't take fluids. What is the outcome in terms of the medical condition that can develop? If you can just explain to the viewers.
Yes, we basically categorize it into 3 stages. The first one is what we call heat cramps. This is when your body is losing fluid but also losing some salt. And what happens here is that you're feeling tired, you're feeling relatively lethargic, but then you get cramps and pain in your lower legs as well as in your upper legs. And normally by then people realize, I've got to do something about it, and you advise them then to go rest, go into their rooms, and then because most of the rooms are basically air conditioned, so the temperature will be 20 to 25 degrees in the air conditioned hotels or the places that they stay in. And obviously hydrate. They must take in fluids. People often think that they must just consume water, but that's incorrect. The reason is that if you think of it, you're actually losing water and salt. So we advise people then to alternate water with some other type of fluid like juice, because juice contains a lot of fluid.
So there should be a balance between the two.
Absolutely, between pure water and as well as what we consider electrolyte or salt containing fluids. So that's the first thing that we worry about, and that is heat cramps. Relatively easy to identify and to do something about. The second issue that we come across is something we call heat exhaustion. Now, we must take into account that most of the pilgrims are in the older age groups, and often they are on medications, and often they also do not have this medication actually impacts their ability to feel that they are getting dehydrated. It impacts their ability to feel heated up, for lack of a better word. And what happens here is that they start getting dizzy, they start losing a lot of fluid, and contrary to what we would consider, the skin won't feel hot. It actually feels slightly clammy and coldish. And what's happening here, they're basically getting dehydrated. They're getting what we call heat exhaustion, where they're feeling drowsy, they're feeling dizzy, they might feel nauseous, they might even vomit, they again might be getting the leg cramps. And people like this, it's not necessary to put them on drips, but it's important to get them out of the sun firstly. Secondly, make sure that they do not have too many layers of clothes on them. Thirdly, to ensure that they get rehydrated by giving them enough fluids. If there's a nice sponge cloth around just to sponge them down, and then also to ensure that they do not quickly go back out into areas where they're going to be again exposed.
Okay, and so you've mentioned the heat cramp, you've mentioned the heat exhaustion. Can you just explain to the viewers the more severe form of excessive exposure to heat as well?
We call it heat stroke. This is where again all the symptoms of heat exhaustion that I've mentioned, like dizziness, nausea, vomiting, feeling lethargic, sweating profusely, all the symptoms are there, but then people can actually collapse and they can get convulsions, which we call fitting. And in cases like this is actually a life-threatening emergency. People like this should be taken to hospital immediately. And luckily the Saudis have adequate facilities for that. The reason why it's considered a medical emergency is that people can die from it. Yes. Or those who survive can actually get what we call neurological effects from it. We call it sequela. They can have brain damage, they can have paralysis.
Okay, so that would be like the weakness on the arm and impaired vision.
And there were quite a lot of cases last year that occurred during the Hajj of last year. What the Saudis are doing is they're putting in adequate amounts of fluid stations along the way. So wherever you are, there's going to be some form of fluid available, either to consume or just to sponge people down. All the hospitals have what they call resuscitation wards available. I mean, you literally walk in there and you see drip set up, you see mist sprays all over there. And as people walk as well along the roads, there's mist spray facilities all over the show. So there is not a real issue as far as facilities are concerned. The more important thing that we actually hamper people about is to prevent it from happening.
So preventative measures.
Absolutely.
Okay, so let's just touch on the topic on healthcare facilities. I know you've been going for the past 14 years with the Hujjaj. Just explain to the viewers the process. Let's assume that this particular individual now is on the verge of developing a heat stroke. What is the process or the mechanism that they need to follow in terms of getting this person adequately treated?
Okay. Firstly, we've got to commend the Saudis for the facilities they put up. There's 25 hospitals purely dedicated to Hajj, 20,000 health personnel, ranging from doctors who are specialists and so forth, nurses, physiotherapists, 20,000 of the medical personnel available. There's 20 mobile clinics going from place to place as well. So there's not a problem of infrastructure. There's more than enough of it. The issue we often have is transport. Okay. Getting a person from one place to the hospital is often a problem. To use an example, I once had someone with what we suspected to be a heart attack. We could see the hospital. It was literally 200 meters away, but it took us 2 hours to get a person there, simply because of the intense crowds. People are coming in one direction, going in another direction. It's difficult to transport someone, for example, on a stretcher or in a wheelchair, getting them to the hospital. Once they are there, however, it's absolutely not a problem. The facilities really are what we consider to be world class. To use a practical example of last year, when we had a dehydrated person, not with heat stroke, but just dehydrated, a diabetic person, we wheeled him in. As soon as you get in, there's actually a doctor standing, what we call triaging. So he stands at the entrance, looks at the person, and then if the accompanying person happens to be a doctor or medical personnel, ask them a diagnosis. In this particular case that I'm referring to, I could say it's diabetic ketoacidosis. Okay. He immediately knew what I was talking about and immediately got 2 porters to make sure that this person goes straight to the emergency unit, but not just the emergency unit, into the ICU unit, where he was put on a bed with 2 doctors and a nurse immediately attending to him. Someone else came in and said they've got a bit of a cut. He was sent to a relatively full waiting area because that wasn't an emergency, but he was seen to immediately as he came in. In other words, the sifting process is excellent.
Okay. So you have the facilities, you have the personnel, it's just getting the time sorted out, the manner in which you actually get there. I think that's more the stumbling block.
Absolutely. It's more the crowds and getting to the facilities. Even dispatching an ambulance with its red lights going out, ringing out like crazy, with the siren going out as well. Even ambulance, if there's 2-3 million people on the plains of Mina, for example, it's difficult for them to maneuver through there. It's just a physical reality that it's going to take you a while to get from where you are to a hospital facility.
Okay. Moving slightly off that particular topic, let's assume you now on Hajj and you develop nausea and vomiting and a bit of diarrhea. I mean, you're there. Explain to the viewers, what would the approach be in terms of self-management in that particular environment as well, and what should they actually take with them before they leave as well?
Okay. Look, strange enough, normally when we talk of travel medicine, everyone talks of diarrhea. The situation is completely different in Saudi Arabia because we see more constipation there than diarrhea, and the reason is that people pop Imodiums all the time. There's this fear right from the beginning that people have because they're there for 6 weeks and they're uncertain of the facilities there, that they're always scared of using the public toilet facilities, and they tend to take what they call preemptive measures, which we think is incorrect. We advise against it, but a lot of them pop Imodiums, for example, beforehand. Now, what we advise people to take is the ordinary medications. So they headache tablets, a bit of nausea tablets. Make sure that it is marked down, written down in case someone stops them at the airport or any port of entry and asks them what exactly it is. The Saudis have no restrictions to self-medication that you bring in, except anxiety tablets and sleeping tablets. Those two are completely banned. So people who are going on Hajj and plan and who are on anxiety or sleeping tablets, what we call anxiolytics or insomniacs, they must be weaned off because you cannot enter Saudi Arabia with those types of medication. So, but everything else you can take with. And people, for example, who have diabetes, who have high blood pressure, asthma, they must take enough medications with them.
For that duration and a bit extra.
Well, we always say at least 2 weeks extra medication because the plane might be delayed, you might lose the medication, it might be displaced, and you only get it a week later. So we normally advise a diabetic, for example, who's going for 6 weeks, to make sure that they have 8 weeks of medication with them. Now, previously, you could get all the medications for free at the Saudi hospitals. But I think the Saudis latched onto the fact that people were abusing the system. So what happens nowadays is that if a diabetic who's run out of medication goes to the hospital in Saudi Arabia, they will be given a script to buy the medication at the pharmacy and they have to pay for it. And with the rand being so weak lately, medications in Saudi Arabia is 3 to 4 times more expensive than in South Africa. But I've just got to put it in perspective. All pilgrims, whether they go for Hajj, whether they go for Umrah, they get medical treatment for free. But they're only going to get acute medical treatment for free.
That would be the emergency treatment.
Emergencies, coughs and colds, runny tummies, for example, they'll get only for a few days for the situation to be resolved. Chronic medications, they will not be provided for because of the reasons that I've just mentioned.
Okay, you've mentioned about the medication being written down on a prescription. I think it's also important for the viewers to make them aware that their medical conditions also needs to be documented.
Absolutely. It's much easier for us to have a doctor's note, and I'm referring here not only to the South African clinic, because we do have South African clinics in Saudi Arabia only during Hajj time, but it's much easier for us if someone comes with a written letter stating the medical conditions as well as the medications they're on, so we can correlate with the medical problems that they present to us with. Now, I've mentioned that South Africa has a medical clinic there.
That's my next question.
What happens is that I've mentioned already that the tertiary care, the specialist referral centers in Saudi Arabia are world class. They are really excellent. The primary care, however, even though the numbers are adequate, there's always a language problem. There's also the issue of not always understanding the medical conditions that the patient presents with. And the classic one that we've already alluded to is that someone who can't speak a word of Arabic or English, for example, and I've witnessed this already. Someone from Ethiopia comes in and shows their tummy. They'll point to their tummy. The doctor or the nurse who's consulting them will either assume that they've got diarrhea or they've got constipation, and it's literally a toss-up. So we've found, and a lot of the other countries have found, that it's much easier to take their own medical personnel with, and South Africa does that.
Okay, so how many medical personnel?
Remember, South Africa's got only 2,000 pilgrims going this year.
Okay.
So we've got 4 medical doctors going and 8 nurses.
Okay. And you're one of those medical
I hope to be this year. No, I'm not one of the official ones as yet, because I still need to sort out my visa. But if I go, I go, and if God calls, I will be there. But so if I go, there's additional doctors. There's always more doctors who are on Hajj performing the pilgrimage who come and volunteer. No one has ever not offered their services. But those who are on the what we call the medical mission, there's 4 doctors, 8 nurses going this year. And we manned, and most of the pilgrims go to Medina first. This is the city where the Prophet ﷺ is buried. They go to Medina first for a week or 2 weeks. So the medical mission starts off there first, and then 1 or 2 will move with the first lot of pilgrims to Mecca. And then as the bulk of the pilgrim moves towards Mecca, those that were left behind of the medical mission also move over. Hajj itself is not based in Makkah itself. It revolves around the tent city, which is the largest temporary tent city in the world, over a period of 5 days, about 5 kilometers away from Makkah. So Hajj starts there and ends there as well. So the medical mission moves with the pilgrims. So we see 2 basic things like what we call primary care problems. Someone whose sugar's out of control, we assist them. 50% of what we see happens to be respiratory problems. There's 3 million people coming, coughing and sneezing all over the show there. So a lot of respiratory diseases are found during the days of Hajj, and especially during those 5 days that I've mentioned now, where the pilgrimage actually is centered around this. Is 3 days in Mina and 1 day on the plains of Arafah. So the doctors and the medical mission moves with the pilgrims. If we pick up something where someone needs to be hospitalized, we arrange for them to be transported by ambulance.
Okay. Another important question I wanted to ask you is, there are certain individuals that are at risk of developing a condition known as deep vein thrombosis when they're actually flying. Could you just explain to the viewers the concept of deep vein thrombosis, which is number 1, and the reason why you need to take certain types of medication as well?
Okay, firstly, DVT used to be called, incorrectly by the way, economy class syndrome or cattle class syndrome. It's really not the issue of on which class you're flying. I mean, the chances of getting a DVT is as big in business class or first class or as it is in economy class. DVT is in effect a clot that develops in the calf of your leg. It's what happens then, and that in itself is not a major problem. The problem is that when a piece of it shoots off and goes to your lungs and causes what we call a pulmonary embolism, and this can cause death.
Okay.
So, in the world-wide setting of being a doctor, which you are also happen to be, DVTs are common. In a hospital, for example, 10 to 20% of people in the medical ward will be developing a DVT. If you're in a ward like a spinal injury or ICU ward, the chances of developing a DVT is up to 80%. So DVTs are common. I mean, it's more common than prostate cancer. It's more common than a lot of other medical problems.
And who are those individuals at risk of developing?
Okay, everyone is at risk. But when it comes specifically to travel, firstly, it's the older people that are more at risk. Secondly, it's those people who have underlying medical problems such as cancers, those people who had a DVT before. So when we talk of the very high risk groups, it's those who firstly are older and who had a cancer, who have a cancer, who've had a DVT before, who've got what we call clotting tendencies, and there's a lot of different, I'm not going to go through the names of it, we call it a hypercoagulable state. In other words, the blood clots quite easily. And then there are those who've had surgery in the last couple of weeks prior to that, because any surgery, whether you're going to travel or not, makes you more prone to DVT. And this is why people, for example, who have a hip replacement, they have a very high chance of developing a DVT, whether they're traveling or not. So surgery in itself is what we call a risk factor. Then people people, for example, who are immobilized, like those who have cast on and so forth, those other people also have a high risk of developing a DVT. So what we advise people like that is a couple of things. The one is that if they must try to not wear tight clothes. Tight-fitting clothes is an absolute no-no. Secondly, if they want to, they can always wear what we call graduated stockings. Okay. And this they can get at a good pharmacy who will actually measure their calves for them and then actually advise them as to what particular size of stocking to wear. Thirdly, when they sit, they must try to go in a plane, for example, they must try to move around as often as possible. We always often ask, so they must try to get an aisle seat and move every half an hour, just get up, stretch their legs, because this type of action prevents the formation of DVT. But when I've mentioned that it's relatively common, if we've worked out that in 2010, for example, there were 9 million people who flew via Oliver Tambo International Airport, and it is estimated that 1% of those people would have developed a DVT. Now, it sounds, to put it in figures, it's 218 people every single day who go via Oliver Tambo that could potentially develop a DVT. But again, most of them will have it resolving on its own. It's those very few that we're worried about, where it can actually dislodge and go to your lungs and clot up. Right? And those who are at very high risk that I've mentioned now, but there's extreme high risk ones. There is an injection that we use, we call it heparin, but the travel doctor or even the GP will be able to tell them about it. This thins the blood. And what we do is we give it to them an hour before they fly. And often it's not possible because they have to be at the airport 3 hours beforehand. So we actually show them how to use it. It's a very easy injection to use. We'd say, we call it a subcut injection, literally just under the skin. Most doctors teach the patients how to use it, and this also prevents the development of DVTs.
Okay. Dr. Parker, it's been a pleasure having you in the studio. We look forward to speaking to you after the Hajj season is over, and hopefully, inshallah, you would receive your visa and you'd be able to share your experiences with the viewers. As I said, it's a great pleasure having you on the show, and we look forward to speaking to you again.
Always a pleasure being here, and thank you again for the invitation. It's always nice to enlighten and inform the viewers as to what precautions to take before they travel.
Thank you for watching. Stay tuned for another episode next week, same time, same place.